Hi, my name is Hilary De Silva. I'm a licensed practical nurse working here in Central Florida, and today we're going to talk about living with diabetes. We're going to discuss 3 different types of diabetes. We're going to talk about signs and symptoms to look out for. I'm going to demonstrate glucose testing, and we're going to discuss treatment options, and lastly, preventing symptoms of hyper and hypoglycemia. What is diabetes really, and what does it mean to you? Diabetes is a chronic long-term disease that occurs when there's a breakdown in the way our bodies metabolize the food that we eat. We receive greater amounts of energy from carbohydrates, starches, and sugars. These foods break down the glucose in our bodies. Insulin is a hormone produced by our pancreas. Insulin allows the glucose to enter into our bloodstreams, and when our bodies don't produce enough insulin or it produces too much insulin, we become hypo or hyperglycemic, meaning that we're now diabetic. 3 types of diabetes are diabetes type 1 that occurs in infants, diabetes type 2, which is insulin or non-insulin dependent diabetes, and it's acquired during our adulthood. And lastly, there's gestational diabetes, which occurs in pregnancy in some women. Now that we know what diabetes is, let's talk about what to look for in signs and symptoms. Polyuria is an increased urination. Polydipsia is an excessive thirst. And polyphagia is excessive or extreme hunger. More serious symptoms may occur when blood sugar levels are extremely high or low. You can fall into a diabetic coma or experience a diabetic stupor. Hyperglycemia is an increased level of glucose in your bloodstream, and hypoglycemia is the exact opposite, which means there's not enough glucose in the bloodstream. The way we find that out is through testing our blood sugar. By using a glucometer and sticking our finger after being clean with alcohol, we can obtain a glucose reading. A glucose reading between 70 and 150 is normal. 150 to 200 is borderline, and anything greater than 200 is hyperglycemia. Physicians like us to keep a record of our blood sugar recordings in this diabetic blood sugar diary. They use the diary to determine what treatments works best for our diabetes. Some treatments being tablets like glyburide or metformin, which is used to maintain our blood sugar levels. Others are use of insulin with a syringe. Newer forms of insulin administration is called the Flex Pen. The Flex Pen is easier for administration because the patient can just dial up the amount of insulin that they need, and it's easier to self-administer. Now that I've spoken to you about the disease and how to treat it, let's talk about some of the preventions. Diet and exercise are the best ways to manage diabetes. The best diets are low carbohydrate diets and exercise to keep our metabolism in shape. Why is it important for us to know about diabetes? Because millions of Americans live with diabetes, and some don't even know they have it. Some of your friends or family members may be diabetic, and now you can notice some of the signs and symptoms. Keeping the key points in mind should make living with diabetes manageable and not necessarily a death sentence. Thank you very much.